Interested in a Dahlia piercing? Let's chat! A Dahlia piercing is actually a pair of lip piercings set at the corners of the mouth, usually set in the dimple area. Like most lip piercings, the Dahlia uses librets, also known as flatback studs, in either 14 gauge or 12 gauge. Most report it to be lower on the pain scale, though remember it's 2 piercings, so you'll have to go through the procedure twice. Do be prepared for significant swelling, which is not uncommon for oral piercings. Now, be aware that Dahlia piercings are advanced piercings that are anatomy dependent. Your piercer has to avoid muscles, salivary ducts, and major blood vessels. Additionally, your bite will be considered to make sure the piercings don't damage your teeth. If your anatomy does allow for this piercing, just know that the placement might not line up exactly where you imagine. And if it's done wrong, the consequences can be serious. So if you're thinking about Dahlias, do your research and go to an experienced piercer, and if they don't do a thorough consultation, go see a different piercer. Your piercer will use implant-grade titanium librets that are slightly longer so as to accommodate for swelling. Remember to downsize them once healed to prevent accidentally biting down on them. During the healing process, keep your piercings clean and avoid touching them. Clean the outside roughly once a day with a saline spray and rinse the inside of your mouth with an alcohol-free mouthwash. And be prepared for a long healing time, as this piercing sees a lot of movement with talking, eating, drinking, and so on. You could be looking at 1 to 2 years for a full heal, or longer if you have any complications. Don't swim at the beach, the lake, or the pool, as they all contain bacteria that can cause an infection. You may also want to temporarily avoid any food that's spicy, acidic, or salty that could irritate your fresh piercings. And if you wear makeup, avoid putting any on top of or around your piercing until you've healed. Now, the Dahlia piercing does come with some risks. Like any oral piercing, make sure to keep an eye on your teeth and gums. Dahlias are especially prone to being bitten down on when you eat or rubbing against your teeth and gums. So if you notice any erosion or damage, talk to a dentist immediately. This piercing is also prone to scarring, which will be quite visible due to its location on the face. So if you're worried about that, you might want to consider a different piercing. Also, keep in mind that this piercing is prone to migration or rejection due to its placement near the edges of the mouth and the amount of movement that area sees. See your piercer if you notice any changes happening to your piercings.